Hello, this is Lindsey Ebaugh. This is the gender-based medicine assignment for culture and human diversity. Today I will be targeted auditing my nurses and medical assistants on the gender-based medicine. What is the difference between sex and gender? Historically, the sex and gender have been used interchangeably, but their uses are becoming increasingly distinct, and it is important to understand the differences between the two. In general terms, sex refers to the biological differences between males and females, such as genitalia and genetic differences. Gender is more difficult to define, but it can refer to the role of male and female in society. Known as a gender role are an individual's concepts of themselves or gender identity. Sometimes a person's genetically assigned sex does not line up with their gender identity. These individuals might refer to themselves as transgender, non-binary, or gender non-conforming. The differences between male and female sexes are anatomical and sociological. Sex tends to relate to biological differences. For instance, male and female genitalia, both internal and external, are different. Similarly, the levels and types of hormones present in male and female bodies are different. Gender tends to denote and the social and cultural role of each sex within a given society rather than being purely assigned by genetics as a sex differences generally are. People often develop their gender roles in response to their environment, including family interactions, the media, peers, and education. Gender refers to the socially constructed characteristics of women and men, such as norms, roles, and relationships of and between groups of women and men. It varies from society to society and can be changed. For instance, high-heeled shoes, now considered feminine throughout much of the world, were initially designed for upper-class men to use when hunting on horseback. Men wearing high heels, hunting. That's great. As women began wearing high heels, male heels slowly became shorter and fatter, as the female heels grew taller and thinner. Over time, the perception of high heels gradually became seen as feminine, and there's nothing feminine about the high heel. The the way it became so feminine is because of social norms making it so. Biological differences between men and women contribute to many sex-specific illnesses and disorders. Historically, it was argued that such differences were largely, if not exclusively, due to gonadal hormone secretions. However, emerging research has shown that some differences are mediated by mechanisms other than the action of these hormone secretions, and in particular, byproducts of genes located on the X and Y chromosomes. Men and women are alike in many ways. However, there are important biological and behavioral differences between the two genders. They affect manifestation, epidemiology, and pathophysiology of many widespread diseases and the approach to healthcare. Despite our knowledge of these crucial differences, there is a little gender-specific healthcare. The prevention, management, and therapeutic treatment of many common diseases do not reflect most important risk factors for the patient. Sex and gender, the omission is holding back more efficient healthcare as gender-based prevention measures or therapies are probably more effective than usual one-size-fits-all approach and would benefit patients of both genders. So addressing gender in health and healthcare therefore requires new approaches at many levels, from training medical personnel to clinical medicine, epidemiology, and drug development. So gender refers to the array of socially constructed roles and relationships, personality traits, attitudes, behaviors, values, relative power, and influence that society ascribes to the two sexes on different differential biases. Gender is relational. Gender roles and characteristics do not exist in isolation, but are defined in relation to one another and through the relationships between women and men, girls and boys. Simply put, sex refers to biological differences, whereas gender refers to social differences. In the last decade, a considerable amount of research has been conducted in the area of gender and health, including gender differences in vulnerability to and the impact of specific health conditions. Gender has shown influence how health policies are conceived and implemented, how biomedical and contraceptive technologies are developed, and how the health system responds to male and female clients. Gender analysis in health has been undertaken mainly by social scientists who observed that biological differences alone cannot adequately explain health behavior. Health outcomes also depend upon social and economic factors that in turn are influenced by cultural and political conditions in society. So to understand health and illness, both sex and gender must be taken into account. Women and men are different as regards their biology, the roles and responsibility that society assigns to them, and their position in the family and community. These factors have been an influence on causes, consequences, and management of disease and ill health, and on the efficacy of health promotion policies and programs. This is confirmed by evidence on male-female differences in cause-specific mortality and morbidity, and the exposure to risk factors. Health promoting interventions aimed at ensuring safe and supportive environments, healthy living conditions and lifestyles, community involvement and participation, access to essential facilities, and social and health services need to address these differences between men and women, boys and girls, in an adequate manner in order to be effective. The aim of this video is to demonstrate that health promotion policies that takes women's and men's differential biological and social vulnerability to health risk and the unequal power relationships between sexes into account are more likely to be successful and effective compared to policies that are not concerned with such differences, and discuss what is required to build a sexual multi-sex section policy response to gender inequalities in health through health promotion and disease prevention. The requirements discussed in this video include the establishment of joint commitment for policy within society through setting objectives related to gender equality and equity in health, as well as health promotion. An assessment and analysis of gender inequalities affecting health and detriments of health. The actions needed to tackle the main detriments of those inequalities. Documentation, and dissemination of effective and general sensitive policy interventions to promote health. In the discussion of these key policy elements, we use illustrative examples of good practices from different countries around the world. Why should health promotion and disease prevention policies and interventions pay attention to gender? Well, there is an overwhelming evidence from all fields of health research that women and men are different as regards their biology or sex differences. Their access to and control over resources and their decision-making power in the family and community, as well as the roles and responsibilities that society assigns to them. Gender differences, together gender and sex often in interaction to socioeconomic circumstances, influence exposure to health risk, access to health information and services, health outcomes, and the social and economic consequences of ill health. So recognizing the root cause of gender inequalities in health is crucial, therefore, when designing health system responses. Health promotion as well as disease prevention needs to address these differences between women and men, boys and girls, in an equitable manner in order to be effective. Today, there is a growing recognition among health professionals, researchers, and policymakers of the widespread and profound implications of gender-based inequalities in health. There's also emerging evidence that integrating gender considerations into interventions has positive effect on health outcomes across various domains. Even though knowledge of gender differences in health is increasingly available, it does not always translate easily in realities of health planning and program implementation. The field of health promotion is no exception. The lack of translation of knowledge about gender equalities in health into health promotion intervention leads to misallocated resources and weakened potential for success. For example, violence against women, arguably the most extreme phenomenon of gender inequality, affects millions of women. Until recently, the magnitude and health consequences of domestic violence against women have been neglected in both research and policy. We have now clear evidence that gender-based violence causes physical and psychological harm. In addition, it undermines the social, economic, spiritual, and emotional well-being of the survivor, the perpetrator, and society as a whole. But it also compromises the trust relationship between men and women. The social, economic, psychological, physical, emotional, and relationship harm to individuals from gender-based violence constitutes a major health concern that requires creative and imaginative responses from a plethora of policymakers and intervention agencies. Dealing with health promotion and prevention of violence in particular, lack of attention to hidden emotional outcome, compromise self-esteem need to be addressed alongside housing, economic support, social welfare, and legal issues as part of an integrative health promotion strategy. Take the top-down approach. The traditional public health approach is top-down rather than bottom-up, with experts identifying problems and formulating interventions while the problems and solutions are perceived by those at particular risk, rarely constitute the base for action. The power of change is then defined primarily in political and professional terms, without the possibility of targeted people to influence and control various determinants of health. Because of power imbalances and because of low representation of women in decision making bodies, women can seldom make their voices heard. As a result, health promotion programs designed in a top down manner will not necessarily correspond to women's health needs. Health promotion policies and activities are the most meaningful when target communities and groups are involved in all aspects of the policy and program development, implementation, and evaluation. For example, the Blue Nile Health Project in Sudan with objective and control water associated disease was perceived as very successful thanks to the particular emphasis in the program on gender related aspects that define women's roles and participation. The study urges health planners to persuade the subordinated communities of women in many African countries, like Sudan, play a more active role in health programs. Take the top down approach. Thank you.